Welcome to the Teen Clinic at St. Michael's Hospital. We see patients with precancer or cancer in the lining of the uterus, also known as endometrial cancer. After you are referred to our clinic, you will see a gynecologist who specializes in surgery to discuss your symptoms and treatment so far. We will ask you about any medical conditions, surgeries, medications you take, and allergies you may have. At this visit, we will do a physical exam, including measuring your height and weight to calculate a body mass index. We will perform an abdominal exam to understand how your weight is distributed, and we'll also perform an internal pelvic exam to feel the size and shape of your uterus. We may also repeat your endometrial biopsy. You and the surgeon will discuss whether surgery or medication is the best treatment for you. Factors such as your body mass index, previous surgeries, and other medical conditions are factored into the decision-making. Alternatives to surgery may be offered, such as taking progesterone medications and working on weight loss before considering surgery. Surgery usually involves a hysterectomy, which is the removal of the uterus and cervix, as well as removal of the fallopian tubes and possibly the ovaries. Some patients can have minimally invasive surgery. This is keyhole surgery using small incisions. At St. Michael's Hospital, we use the Da Vinci robot to help us perform these surgeries. The robot is controlled by the surgeon. In Ontario, robotic-assisted surgery is recommended for people with a body mass index of 35 or higher who have cancer or precancer of the lining of the uterus. At your first visit, you may sign consent forms to go ahead with surgery. Before signing them, it's important to know that there are risks to having any surgery. These include the risk of infection or developing a blood clot in your legs or lungs after surgery. Other risks are needing a blood transfusion because of extra bleeding or injuring other organs near the uterus, such as the bowel or bladder. These risks are higher when someone has a higher body mass index or has had multiple surgeries on their abdomen. Your surgeon will talk to you about these risks. There are also some risks of anesthesia, which the anesthetist will discuss with you prior to surgery. If you need support, let us know and we can involve our social worker. Your surgery will be done by one of our gynecologists who performs robotic surgery. Your surgeon may be different than the doctor you meet at your first appointment. This helps us to schedule your procedure as soon as possible. We are happy to answer any questions you may have at your first appointment, so please come ready to discuss. We look forward to meeting you and guiding you through this journey.